In moments of crisis, every Toledoan can rely on Toledo Fire and Rescue Department to provide emergency and fire services of the highest quality. Toledo Fire and Rescue Department holds an ISO Class 1 fire insurance rating, the highest possible rating in this category, held by less than 1% of departments nationwide. From the inception of the City of Toledo 911 system in 1989, there has been an exponential increase in 911 calls, while the number of Toledo residents has decreased. In 1990, 330,000 residents made 40,000 calls for emergency assistance. In 2017, the population of Toledo had decreased to 280,000, and the total number of 911 calls for fire and emergency services jumped to over 60,000. A 15% smaller population made 33% more calls for help. Less than 10% of the calls request a response to a fire. The remainder include calls for medical emergencies, such as heart attacks, strokes, workplace injuries, water rescues, and automobile accidents. But there are ever-increasing calls for non-emergent needs as well: flu symptoms, wound care, transportation to the hospital, pharmacy, or doctor's office, loneliness, confusion, lack of food or heat in the home, mobility issues, such as transferring from the bath, or even the inability to reach the television remote.
I think it takes a toll on everybody involved. First responders, going on these runs, hospitals that take our patients after the fact. It takes a toll on everybody. A lot of the runs we go on, people are just uneducated on to what an actual emergency is. People have been using it.
In a 12-month period, over 5,000 calls resulted in a finding of no true medical complaint. These calls, while non-emergent, represent genuine needs and lack of resources in our community. If 911 calls continue on this trajectory, what will it mean for the City of Toledo? A strain on the budget that is unsustainable, a shortened lifespan for highly specialized equipment, a department of firefighters pushed to exhaustion, and, most importantly, citizens of Toledo with unmet needs.
Sure. I've been on the department for 9 years, and every single year we've had increased run volume. And it's not that the firefighters don't want to do the work. We're excited to get out there, excited to serve the citizens. It's what we do. It's what we signed up for. But the increasing run volume, it's been an issue. I think fatigue in general has increased among all the firefighters. I don't have numbers to document it, but I'm guessing that injuries, sick time issues, all these are big factors with the increased run volume. In addition,
Toledo Fire and Rescue has a duty to stay with a patient once contact is made until they have completed the call. As additional 911 calls are received, they can start a chain reaction of stations having to respond to calls at ever greater distances. At times, crews may be going several miles outside of their primary response area, delaying care for patients in critical need. For example, a call comes into Station 17 for a person who's had a nagging cough for 5 days. Shortly after the first call comes in, a second call for a car accident comes into Station 17's area. But they are at the first call, so Station 25 responds. Then a call comes in for 25, and they are in 17's area, so another crew has to respond, and it goes down the line.
I think the biggest problem would be the non-emergent runs where people could utilize resources that are available to them, but they do not, for whatever reason, they may not be aware of them, and then they call 911. One of that would be a non-emergent run, and then a fire comes in your district, and the apparatus that has the water on to be able to put out that fire is not able to respond to that run because they're working with a patient that may or may not need 911.
Another concern is the recurrence of calls from a small number of individuals. In 2017, 20 patients were responsible for 851 calls. That equates to an estimated $250,000 in expense. And while those 20 patients were able to get some relief from the Toledo Fire and Rescue Department, clearly unmet needs remain, resulting in repeat calls. When citizens call, TFRD responds, prepared with skill, courage, and commitment to their mission to serve in any emergency. Increasingly, however, they are providing short-term relief for chronic needs. We need to create lasting solutions by matching patients with service providers who can connect them to needed resources. How do we do this? With your help. Toledo has a broad array of resources administered by caring providers, and we need to work together to connect people and solutions. Together, we can create stronger pathways to needed services and programs. Together, we can create change.